What did you feel when you heard that sound? It means something different to different people for sure. Some might feel happiness, peace, blessed. What about something that can hold all of those things together at once? What about joy? You know, joy is actually a very powerful emotion. It's actually a mental state because joy is something that you have to choose to feel regardless of situation or circumstance. Joy's been studied quite a bit over the past several years, and what we know is that joy is a known contributor to improved physical well being, mental well being, and overall quality of life. There's even an emerging field of study called human flourishing. And with human flourishing, it basically looks at what are the conditions in order for an individual to be able to achieve and sustain optimal physical well being, mental well being, while also feeling a sense of purpose and fulfillment. And joy is a known contributor to what helps humans flourish. So this is really intriguing to me because aside from me constantly being on the journey to figure out my own optimal well-being and find a sense of purpose, I actually was intrigued by human flourishing also because I am a healthcare executive. And in my line of work, I'm responsible for thinking about national strategies and programs where we can help improve health in all of our communities across the nation. And let me tell you, that's a challenge, right? And so, this concept of how human flourishing can play a role in advancing some of the biggest challenges we have in healthcare really piqued my interest. So, we're going to talk about that in just a minute. But first, let's spend some time talking about joy and how our brains experience joy. So, remember those feelings that we just shared: blessed, happiness, joy, right? I got to admit, it was a setup. I did set y'all up, okay? Uh, and the reason why I did that is because I needed a metaphor to help you understand how our brains work. Okay, so each one of those notes that I just played, they were all different. You know, they're completely different notes, but when grouped together in a specific way, it forms a song. And that song helps inform our thoughts, our feelings, our emotions, and then how we act. Our brains work in that exact same way, well, similar way, right? So all day long, our brains are just taking in bits and bits of different information, lots of different data points all day long. And our brains group those data points together, and those data points form stories. Those formed stories inform how we feel, our emotions, how we act. Okay, so let's take this back to joy. There's a part of our brains called the nucleus accumbens. And this part of the brain plays a vital role in helping us experience joy. So, going back to those data points that we pull in all day and the stories that we tell ourselves, that actually tells that part of our brain whether or not it should interact with our neurotransmitters and release dopamine and serotonin, which impacts our quality of life. All right, so now this is getting interesting. This chart that you see here is a chart of life expectancy amongst countries that are very similar to the United States as far as the wealth, okay? These are our peer countries that are more wealthier democracies across the world. And what you see is life expectancy compared to healthcare expenditure per capita. And so what you see is that some of our peer countries, Norway, Switzerland, Japan, they are experiencing some of the longest life expectancies and the lowest healthcare expenditures per capita. That red line you see there is the United States, where we are experiencing some of the lowest life expectancies comparably with the highest healthcare expenditures per capita. And what's even more challenging is that if you were to dig into that red line even more, there are even greater disparities between groups of people here in the United States. Gaps, deficits, disparities. This is the type of data that I work through all day long and that I'm inputting all day long. And if we were to go back to my little metaphor maker over here, I just wonder if you will just indulge me for a moment. What does that data sound like? Well, I cheated a little bit. I think it sounds a little bit like this. Yes, I ended on a cliffhanger on purpose. Because that's what it feels like. That's what it sounds like to me. You know, how did you feel when you heard that sound? It feels tense. It feels a little bit more tense in the room. Y'all didn't like that sound as much as you liked the first sound. It's okay, neither did I. You know, it reminds me a lot of one of those dreams where I'm being chased and I'm not getting any faster. And so actually, it's a nightmare, right? But when I look at that red line, that's what that reminds me of too. You see, this chart details almost 50 years of data. And as you can see, we're making very little to almost no progress, like we're being chased by our challenges. But then comparably, it does make you wonder, well, what does it sound like with our peers, right? They're over here flourishing. And that's actually the case. If you look into it, our peer countries are actually making significantly more investments in human flourishing and conditions that help individuals flourish as their approach to healthcare. And so what does that sound like? Like, what would it sound like if we began to harmonize our own approach? I mean, obviously, we would start where we are now, right? But instead of a cliffhanger, could we resolve it? There's the other half of that melody. What did you feel when you heard that sound? I got some head nods. We're friends again. Yeah. That felt like hope. You know, I'm not at all trying to diminish the challenges of health equity, and nor am I trying to say that human flourishing can replace health equity. Because the reality is the challenges, the structural and social determinants that actually contribute to health inequities are very real challenges. And so on that note, pun intended, health equity is actually a precursor to human flourishing. Human flourishing can't exist without health equity. But when we bridge the two together, we create a harmony that allows us to think about a new sound for the approach that we can have in healthcare. And you know, this is not just aspirational. There are actually well-researched, validated tools available right now that would just allow us as a starting point to be able to measure how individuals are experiencing joy, because joy is one of those key contributors to human flourishing, right? For example, the Risk Psychological Well-Being Scale. This is a scale that assesses how individuals are experiencing different dimensions of psychological well-being. There's another one, the Hope Barometer. This is actually an international study that was started by a university in Switzerland, one of our peer countries. Many of our peer countries are a part of this study where they're essentially looking at how hope plays a role in overall well-being. Another one, the Flourishing Scale, which measures You guessed it, flourishing. It measures how an individual is experiencing different dimensions of human flourishing. And last but not least, there's even a new national strategy in Norway right now called the Joy in Life in Older Age. It's part of their national scheme where they're building a tool to test how you can help individuals who are at the end of their lives still experience joy. Isn't that amazing? I mean, the power that we can have when we start to rethink how to harmonize our approach to healthcare is very real and it's very tangible. And there are actually communities right now who are experiencing the benefit of beginning to harmonize this approach. I will leave you with 3 quick examples. The Big Local Initiative in England. Through this initiative, 150 communities throughout England received £1 million in funding. And with that funding, residents of the communities were the ones that got to determine how they would spend these funds in order for their communities to thrive. As a result, they're already seeing a significant improvement in mental health in these communities, a significant improvement in social cohesion, and a significant improvement in individual self-agency. I believe I can be well. Another community, let's bring it local, actually 3 communities here in the United States. There's a pilot that's being planned right now called Investing in Flourishing. And as a result, there's a public-private partnership that's been put in place. It's multi-collaborative. Residents are at the table, and they're all at the table working around answering one question. What does a child need in this community in order to flourish? As a result, they're investing in daycares, job training centers, better education centers, green spaces, community gardens, swimming pools. I mean, you name it, they're investing in it because those are the conditions that the residents have recognized are necessary in order for a child to flourish across their lifespan. And last but not least, I leave you with Albert Lea, Minnesota. It's actually one of the blue zones here in the United States where over 14 years ago, their community leaders got together and originally they said, how do we tackle obesity and tobacco use? Great question. But then their residents came to the table and said, well, why don't we think about what we need in order to actually thrive? And as a result, they started forming community walking groups. They started forming community gardens. They even started putting together purpose workshops. This is over 14 years of work that has completely transformed the culture and the environment of this community because today they have 30%, a little bit more than 30% reduction in high blood pressure and high cholesterol among their residents. Their residents are living longer than their chronological age, and here's the kicker. Residents of Albert Lea, Minnesota actually live longer than the state average today. That's what health equity looks like. That's what a harmonized approach to health equity looks like. Can you imagine the power of our nation if we all began to think differently about healthcare by approaching it with harmonizing it with this one question? What do people need in our communities to flourish and experience joy in their everyday lives? Imagine what that would sound like. Thank you.